Hello, this is a video for community pharmacists to give you some IT tips on how to deal with CPCS referrals, that's Community Pharmacist Consultation Service referrals that you receive from GP practice via NHSmail. So if we look at the screen now, here's a dummy demo patient, and the GP practice has referred the patient to a pharmacist, and this is how an email might be received by that pharmacist. As you can see, there's an attachment here, and the first tip I would say is that you may think, could I just quickly edit it and return it back to the practice with some updates? Unfortunately, this Word file is usually password protected, so you might be able to edit it, but often you might not be able to edit it. And we'll show you that in a second. Another tip at this stage is, your referral could end up in your junk folder in your NHSmail. One useful thing would be to add in all the local GP practices to you into your NHSmail contact book, so that there's less chance of it going into junk. Right, so what we're going to do is we're first going to save this file onto our desktop in this case. Wherever you save it, the most important thing is after this whole process, delete the file. At this stage, what I'm going to do is I'm actually going to change the file name. I'm going to put the patient's name. This reduces the risk of later down the process of getting the patients modelled up. So here we go. I'm just going to save that file. And now if we look on our desktop, we can see that file that I've saved. So if we now right click and open it in Word, and if we try to click here on enable editing, and if I scroll down, this is the referral form. If I scroll down slower, you can see the referral form. For the first section is what the GP practice has done. It's got referral details, name, GP practice details, what they've indicated. So in this case, the referrals for lower back pain in Minnie Mouse, and there's a bit more information by the GP receptionist, so back pain after lifting lots of cheese. And that's just the red. And this section at the end is the section for the community pharmacists to complete. So if you try to click in here and you try to type in something, you get this warning saying restricted editing. And if you click on stop protection, it's asking for your password. So you just can't unlock this document. And this password protection is actually put in by the GP's IT system. So it's not just a simple case of giving you a password to tell you how how to unlock it. Your GP practice that referred the patient to you won't be able to help you unlock it. Right, so what can we do? Well, what I'm going to suggest is that you save it again, and this time, rather than saving it as a Word document, you save it as a PDF file. And here there's an option on this Office version that it opens a file straight away after you publish it. So if we click on save. Now just suppose you didn't have the latest Office and you couldn't do this save as PDF option. Sometimes you may have an option that does print to PDF. So you have some functionality where you can actually print it. It's like you're printing a document, but rather than send it to your printer, it converts it into a PDF file. So that may be an option that you have. So let's save this. And now it's opened it straight away for me in Adobe Reader. So Adobe Reader is a free product to download, so it doesn't cost you anything to download it. But why we've done this is because we can then actually enter stuff in. So if you click on the box here that says sign document by typing, we click on that, it actually gives you on the left hand side this text writing option. So you can see the sort of characters AB. If you click on that, and now you can actually type into the form. So if we say 5th of December 2001, pharmacist name, whoops, sorry, didn't click there. So if we go back, so yeah, then we go Mr. Pharmacist. Okay, and then pharmacist email, dummy email. You can see I've done this before. Right, and if we scroll down further, to see the section that we're going to complete. So what is the history of the problem? So it might be 2 days of back pain started after lifting heavy container full of cheese. So it could be, we could be typing in back care advice, rest, etc. Might be counter analgesia. Okay, and might be that you gave, we sort of saw them, it might be that's what we've done. And it could be that we're saying none expected at this stage. There, we've done it. So we've completed the document, and that's done. So if we save it, again, when we're doing it, so saving it, it says, do you want to replace your existing file? We click yes, then close that, and then close the Word document too. And if we go back to our email, we might want to just reply back and say, dear GP practice, please find attached outcome of consultation with patient for you to save to records. And if we attach the file, an area from the desktop, the mini mouse referral, and that is done. We can just click send, and we've sent back to the GP practice the outcome. So that's probably the fastest way to do the process. Saves you having to sort of print off a document, fill it in by hand, scan it back in, and email it back. So it is fiddly. It's not I wouldn't say it's the best experience. We've obviously got to look at different IT solutions and platforms for the whole process. But at this stage, would be what we'd recommend on how to manage it. So the only final thing to remember to say is before you finish off, make sure you delete those files on your desktop or wherever you save them, if it's got patient data, and make sure you clear your recycling bin too. I hope you found this helpful.